Very
Hello.
good morning to everyone present here. And I,
Hello.
Damodar Naik, Assistant Professor, Department of Pharmacology, would like to welcome you to this session on research and entrepreneurship in pharmacy, the journey by Dr. Ajit Singh, who is the co-founder and CEO of Climate Research Solutions India, and he is also a ICMR scientist at MAHE, Manipal.
I requested Dr. Kesha Desai to proceed with the introductory note.
Dr. Ajit Singh has completed his Ph.D. in cardiology from Manipal Academy of Higher Education. Recently, he was appointed as a research scientist for ICMR at the Department of Medicine, Kasturba Medical College, Manipal. He is also serving as National Director for Research at World Youth Heart Federation and Principal Investigator for Manipal Heart Failure Registry. In July 2021, he was appointed as Vice President of Medical Artificial Intelligence winning at Indika, Mumbai. Dr. Singh has published more than 40 papers in different streams of medicine, including cardiology, cardio-oncology, and infectious diseases. He serves as an honorary reviewer in many reputed journals, including Oxford Group, BMJ Group, and Springer groups of journals. He has received several international research and travel grants from estimated organizations, including European Society of Cardiology, ICMR, DST-SERB, and the American College of Cardiology. He is also recipient of Young Achiever Award in 2019 and Young Scientist Award in 2020 for his contribution in cardiology research.
Thank you very much, madam, for a nice introduction. Okay, so good morning, everyone. First of all, I would like to thank Ramaiah University of Allied Health Sciences for inviting me for this webinar. And thank you, Dr. Anbu and Dr. Tanuja, who was constantly in touch and who has coordinated very well, and Damodar sir and Nga madam and everyone, and the joinees, attendees. So thank you very much, first of all, for giving me this wonderful opportunity to speak about entrepreneurship and research journey. So I would like to start with something. This is not as something technical presentation here. What I'm going to present in front of you. That is my own journey and whatever I have experienced on my way to reach this. Right now, what I'm working, where I'm working. I'm working as a research scientist for ICMR. So that is one of the reputed organization in India, government organization, and national director for research at World Youth Heart Federation. And then we have started our own startup, that is Climate Research Solutions. So the multiple things what I've learned through my journey of this educational journey and this entrepreneurial journey and this research journey, I would like to share that with you. Okay, and I hope you will get something out of it, something positive out of it, and you are going to definitely, I'm definitely very sure that you are going to get something out of it, because there are a lot of ups and downs. There are a lot of things where I was stuck, where how did I start my own journey of climate research solutions, and how did I fight with the government, DCGI, and everything. So how I entered into the research and how I pursued the research to the next level. Okay, so let me start with a basic conflict of interest. So I do not have any conflict of interest to declare right now. So this talk is especially arranged to know our interest and build up our career on the interest. Okay, so based on that, we'll choose how to go, where to go. So how did I do? Okay, so same thing I would like to share with you, and I would like to enlighten the things how you can pursue your career of research and how you can pursue your career of entrepreneurship. So I hope all of, as I was talking to Dr. Anbu yesterday night, so he was telling me that most of the people, most of the attendees are from, pharmacy background, and family people are also joining. So, I am BPharm and PharmD both. So I know how it looks like. I have gone through the BPharm also. I have gone through the PharmD also. Okay, so I know both the things, and I know what's the importance of BPharm and what's the importance of PharmD. So that is my educational journey. I started, I've completed my, 10 plus 2 from a Hindi medium board in Uttar Pradesh. And then after that, I have joined BSc like in 2006 to 2009. I did BSc, and then in 2008 only I joined B Farm in between, like lateral entry, and then I completed my Bachelor of Pharmacy in 2012. And after that, that time PharmD was very new. PharmD was very very new, and I and my friends were discussing about PharmD. So that time we thought like, okay, let's go. This course is really fascinating, and PharmD is something where we will get the doctor's degree in front of our name. We will get the doctor. So that was the only motto, guys. That was the only motto, because from where I did my B Farm, that college was not that great, and that college was not even the PCI affiliated. So we used to fight even in our B Farm for the PCI, and when we left the college, that time it got PCI affiliated, and surprisingly, we were the last batch of our B Farm from our college. So after that, they closed the pharmacy in that college. So, that was a very struggleful journey, I would say, of B Farm. And then we came to PharmD, Doctor of Pharmacy. I joined PharmD postbaccalaureate in Manipal, because Manipal is, still one of the top institutions for PharmD and one of the top institutions for pharmacy in India. And that time it was number one. Right now, I think it's seventh or eighth as per the NIRF ranking, but that time it was number one. So and the best, why it is best, I would say, guys, we have our own hospital here, big 2600 bedded hospital, and the pharmacy practice department is completely in the hospital. This is not in the pharmacy college. Pharmacy practice department is totally settled down in the hospital. So we get all the exposures, whatever the clinical pharmacy students need, whatever the pharmacy practice students need. So we have all the exposure, we have all the doctors, we have all the patients, all the departments, whatever is your interest, you can just go ahead and learn from the people. So I finished my PharmD postbaccalaureate in 2015, and then I joined PhD in cardiology. So let me tell you guys, that is the thing, from where I started my research journey. In 2014, I was in my second year of PharmD postbaccalaureate, means the fifth year of usual PharmD, and we used to go for the ward rounds. We used to go for the ward rounds, and we used to have, we I think still have that 6 months project for PharmDs, in the fifth year or the second year of PharmD postbaccalaureate. So cardio was my main interest. So it generates from the interest always. So whatever is your interest, always look into that. Always try to focus on your interest, whatever is your interest. Because if you are going out of the interest, you will not pursue that thing professionally and emotionally, and you will not give 100% to that. So cardiology was my passion. Cardiology was my interest. So I thought like, okay, I'll do my things in cardiology. So I started going to cardiology, and I have finished some time in cardiology. I mean, though my fifth year project was not in cardiology, my fifth year project was in infectious diseases, MRSA, but I shifted to cardiology to learn cardiology. And I used to go, out of the box after finishing all the ward rounds of whatever was given to me. I used to go to cardiology and try to learn the diseases, try to talk to the patients, try to roam in the ward simply to see what kind of patients they are seeing, what kind of things they are they're going on. I used to do that. Then, it was again the, what we say it, the internship, which was started in 2014 only, 2014 mid. So our internship started, and then we started, going to different wards. So first thing, they posted us in medicine. Okay, they posted us in medicine for 3 months, and in medicine, I was going again. I mean, I was a kind of a learningful student. I used to go and I used to learn and I used to see into the files. I used to look into the files. I used to go for all ward rounds and I used to check whatever the physicians used to talk to their PGs. Whatever discussions were going on the diseases, on the symptoms, on the medications, charts, or doses, everything, and we used to listen properly. We used to do that carefully. But as this is a universal problem in India, that we all suffer at some point of time. We all suffer that clinicians, they don't give that much attention to us. But still one day I remember that one day we were on the rounds and we were in the last row of that where first the doctors used to stand, the main head doctor, and then the assistant professors and all, and then PGs, then UGs, medical UGs, and then us. So one day doctor has asked one question to the PGs, and they did not have the answer. But we used to study, so one of us and I knew the answer, and I gave that answer. So the doctor was quite impressed, and he told, like, okay, who are you guys? That was after a month of the rounds. He asked us that, who are you guys? We also, we are PharmD interns, and we are posted here for 3 months. So he told, okay, so what's your role and responsibilities? What are the things you have to do here? Why you are joining us? So what is the exact PharmD means? So we spoke to him for some time, and he was quite impressed. He told, wow, you guys are really something aidful to us, something a kind of helping hand. So why don't you help us really? So he started giving us tasks. He started giving us the multiple task of finding ADRs, finding the medications, finding doses and everything. And that time, one day, the same rounds, one day he was asking his PGs, like, okay, guys, there are very much interesting case reports. Why don't you publish these case reports? So, I used to read a lot of case reports. I used to read a lot of, research papers, because this is Manipal. They teach us from the startings, like how to read, how to go for research, how to run the research, how to, pursue the research, different type of methodologies, and, case series, case reports used to. So, I just came across a good case. Good case means the case was normal, normal AIDS case, HIV, and immunodeficiency, and along with that, keratitis case, that eye problem, and then disseminated tuberculosis. Multiple problems were in that case. Okay, disseminated tuberculosis was actually in the lungs, in the kidney, in the brain, everywhere. So I thought, like, this case is really good. So I just asked him, like, sir, can we can I give a try to publish this case? So he told, it's a normal case. I told, yes, it's a normal case, but that time I knew that BMJ, this British Medical Journal, one of the top journal in the world. So they have one more category. They have one journal, their own journal, BMJ Case Reports, and in that there is one category, like unusual combination, unusual combination of problems, symptoms, and everything. So I told, let's try. So he told, that's okay. You can at least you will learn how to write the case. Then let's get it, and let's try. So we wrote it. I wrote it very well, actually, and I thought, like, okay, let's give it a try in BMJ. I was scared because it was BMJ, and people don't try on their first attempt in BMJ, British Medical Journal, or these good journals. So but still, I sent my paper to British Medical Journal, and after 2 reviews they accepted it. So that's how my first research paper, my first research started from started with a case, with a simple case. It started with a simple case, and it was published in British Medical Journal, guys. Okay, so the moral of the story here is, if you are a PharmD or M.Pharm pharmacy practice, okay, you must go and check the cases, check the files, check the unusual combinations, check if you find something new, check. okay, based on your interest and sometimes out of the interest. If you find out something like, okay, this is something new for me, okay, maybe it's not new for everyone, or maybe it's new for everyone also, but if it is new for you, please go for it. Please check why it is happening. Okay, I'll tell you, there is a very basic rule in Six Sigma. There is Six Sigma rule of management. So how they tackle the problems in Six Sigma. Okay, Six Sigma is a management rule. Is a entire management actually. So how they tackle the problem from the customers. Usually they ask five why. 5 why. First they ask, okay, why it is happening. Then they reach one more question, and then again they ask why it is happening. So they ask at least 5 times why. So always that applies everywhere, guys. If you find out something new, so ask at least 5 why to find the answer. And I'm very sure in 2 3 why you will get the answer. Okay, after 2 3 why only you will get the answer why it is happening. Okay, so please try to find out that why. If you are finding out that why, if you are spending your time in finding the why, and how you are going to find out literature, you just read the books, read the journals, read the literature. Nowadays, PubMed is free, Scopus is free, Web of Science is free. At least if everything is not open access to everyone, at least you can read the abstract, at least you can get some knowledge. Okay, there are multiple websites, there are websites for everything now. Okay, universities have their own website, all the universities of Harvard, Harvard, Oxford, Cambridge, and these medical colleges, and in India also AIMS, they all have the websites. They all update all the details in ICMR websites even. So they all have those websites. You will get the information from anywhere. So start learning that, start finding that. You can start that research journey from your basic only, like from a case from. And why I'm telling you, see, it's not necessary to go for all the cases. I know that if you are going to the hospital, you must have to collect 10 cases for your records. You must have to see 10 cases or 15 cases. But just look at one or two which are in your interest, very interesting cases, or something new, or something you'll find like, okay, I never read this, why it is happening, why this I never read this, let's learn about it. So whatever new comes your way, please go ahead with that, please learn that. Okay, and you will find something useful, definitely you will find something useful. Okay, and it's not only that you are reading about the case, read about the symptoms. If any, there are some typical symptoms for every case, like for heart attack, chest pain is there, breathlessness is there, fatigue is there. Okay, and jaw pain is there. But if it is not there, if something else is there, why it is happening, try to correlate with history, try to correlate with medication histories, try to correlate with surgical histories, try to correlate with infectious diseases. There are thousands of the things, but you just have to correlate the things. And I'm very sure if you start correlating the things, if you start asking that question to yourself, to the file, to the patient, you will get the answer. And that answer is always beautiful. Okay, answer is always satisfactory. It shows that you put an effort and you are getting into that. Okay, and I am very happy that my fruit, my the result of the first effort was published in British Medical Journal, and that encouraged me to do a lot, after that, first publication in 2014, I did not stop, and in my Farm D itself I published 7 papers. Out of 7, 3 were case reports and 4 were original research papers. So in internship, I was on fire. I started writing papers, I started finding projects. I used to go to physicians, I used to go to my mentors, sir, give me some project, give me some projects. Even I published 2 of my seniors thesis. you know they were busy in industry, they got job in industry, and they're like, they told, okay, you go ahead with the publications. They gave me their theses and I started learning that. And that was the point, that was the turning point. I entered into the research. So research is nothing there. You need something to start. This is just a spark you can start, and you have to start in your student life. I must tell you guys, people, I have launched our course in clinical research recently. So I got many questions from the, freshers. They ask me only single question, sir, why, companies or industries are not taking freshers? They don't entertain us. They don't entertain our CVs. You know why they don't entertain your CVs? Why they don't entertain freshers? You think all the freshers they don't entertain? No. Companies, if you look into the actual data, the industries or the research center or the ICMR or the NIH, they consider 60% of the freshers to their jobs. 60% of their jobs are reserved for the freshers. Okay, and still freshers tell that we are not entertained by the company, by the industry, by the research centers. I'll tell you what's the problem there. The problem is the experience during your learning time, experience during your PharmD, experience during your M-Pharms, experience during your PhDs, experience during your, whatever B-Pharm you're doing. If you are M-Pharm, pharmaceutics, pharmacology, quality assurance or anything. If you are not exposed to research, how can you expect the job in research as a fresher? Tell me, if you are in PharmD, if you are in M-Pharm, quality assurance, if you want job in research, you have to get that experience. Experience means they don't want experience from the industry. They want your exposure in your study time. Whenever you are pursuing your degree, exposed to research. Okay, whatever, if you want to enter to the research industry, you have to expose yourself to the research during your degrees, during your study time only. If you are PharmD, start your research from the fourth year, because you started going to the hospital from the fourth year. Your ward duties, and then your in the fifth year you have project, especially project. Do that project sincerely, get the good topic. Okay, if you are getting a good topic, there are the high chances of publications. And publication is the only result. Publication is the, one of the best part which will grow your career exponentially. Because publication is something which will expose you to the world. World will come to know about you. If it is really good topic, many people will see it, many people will read it, many people will, cite it. So that will give you exposure. And if you go somewhere, okay, my publication was done in 2.5 impact factor, it was published in more than one impact factor, whatever, I'm just telling you, I have published my papers in 10 plus impact factors, multiple papers. So it is the research what you have to start from your basics, from your study time only. Okay, then you can expect a better job. And once you are done, once you're completing your studies, your PharmD, your M-Pharm, your PhD, you are getting hired at priority, guys. Okay, so this question, don't tell that you are a fresher and you are not getting hired, because the interviewer, they ask, what did you do in your PG? What did you do in your PharmD? What did you do in your PhD? So they look at your skills, if you are really exposed to the research or not, if you really have done something, some projects, some publications or not. That is important, guys. Okay, that is very important. So start that. That is the sparkling point for all of us as an as a student to start our research journey. Okay, and then after that I'll come to that journey again. I was in internship, and I used to go to medicine, and then from medicine again I was posted in cardiology. So cardiology is my interest, as I told you, it's my passion kind of thing. So I used to go to cardiology, but after 3 months they told no, now you have to go to dermatology or psychiatry. I was least interested in dermatology and surgery. I was least interested, so I told, can I continue in cardiology only? So they told no, as per the syllabus, as per the PCI rules, as per as per the book, you have to go to dermatology. Okay, I'll go to dermatology. I used to go to dermatology for first 2 hours, 3 hours, and then I used to go to cardiology. I used to spend my maximum time in cardiology. If no time from dermatology, I used to go in the evening to the wards. I'll come to that point in the later slides. Okay, so I did not leave the cardiology research. I did not leave the my cardiology interest in between. And that when I was in PharmD, internship, almost half of my internship was completed. Then, I mean, I used to talk to all the faculties in cardiology also, and they used to, understand the things. They used to entertain me, really good, because I used to solve their questions. I used to, write their prescriptions for them. I used to help them in, finding errors and ADRs and everything. And I was doing really good in that cardiology also. So, and I told them that I have published a few papers till date. So the HOD, because see, guys, clinicians don't have time. The doctors, they don't have time for research. They don't have time for publications. So they look for someone who is really enthusiastic, who can really give some time, and who can really, go through that, research part, who can help them. So the HOD cardiology told me that why don't we, write one proposal. He had one idea and I had one idea. So we talked over the ideas. Then we came up with another idea, and he told, why don't we write for the funding agencies? Why don't we write the proposal for funds and start this journey? If you are interested after PharmD also, if you don't want to leave, we can start something, this, and then you can pursue your PhD also. So I told, I don't know about the PhD, but let's write the grant. Okay, and in my PharmD fifth year, I mean sixth year only, by the end of my PharmD, we have written one grant, and that grant was my Manipal Heart Failure Registry. That is India's largest registry in heart failure till date, and it is one of the world renowned registry in heart failure. The papers have been published in 10 plus impact factors. Papers have been presented in, I have presented my papers in Austria, Hungary, Netherlands, and recently in May I went to Spain, Madrid. So that registry is still going on, and the results are been, have been presented everywhere in USA and in, Dubai, and multiple conferences. Since 7 years we are presenting those, every year we are adding up to the results. Everyone, every year we are adding up to the, cases. Every year we are adding up to the research, and we are coming up with breakthrough results. Okay, so results are breakthrough, to all of us. There, we are very much amazed that we have that rich data that we can show to the world, and we are showing to the world that data. We are presenting everywhere. I'm traveling at least twice or thrice in a year, internationally, and that is totally on the funds of the organizer or the government. Till date, I have visited almost 15 countries, guys, and did not spend a single penny from my pocket. So that is the, the happiness, the result of the research. And your professor must, must be, going for the research conferences. They must be, presenting their works. You must be presenting your work. So it is a fun. It is, something which gives you pleasure, which gives you satisfaction, actually. Right. So, that I'll come back to the research grant thing. So we have submitted that research grant to 6 agencies, 3 government agencies and 3 private companies. And it was accepted by ICMR, it was accepted by Novartis, it was accepted by one more company, Servier, from France. So for the grant, and you won't believe, guys, we were struggling in like which grant we should take, because ICMR proposed 34 lakh, 36 lakh, and Servier proposed 56 lakh, and the another company, Novartis Pharma, has proposed 96 lakh grant for our, registry. So finally we went up with Novartis. We took that 96 lakh. That was again, converted to 1.5. It was extended to 1.5 crore. We stopped at 1.2 crore because we got another funding agencies, and we started self-funding later because, because of some conflict with the company. But till 1.2 crore, we got the funds from Novartis, and we continued that. Still, it is like a Novartis registry only. Still, it is a Novartis funded registry, but they have funded till now 1.2 crore for my registry, for our registry. So that is the fun, that is the love. In PhD, people get the stipend. Here at Manipal also, they used to get a stipend of 20,000, 22,000, 25,000, year wise. But you won't believe, guys, in my PhD I was taking 80,000. the grant stipend. Okay, so I mean, it is amazing, guys. It's amazing how research can, give you a lot and a lot and a lot. If you are really interested, if you're really enthusiastic, and if you are thinking of only one thing, that is your passion. If you're following your interest and passion, my interest and passion is totally research now in cardiology. I mean, I have changed my research area for last 1.5 year because ICMR has appointed me as a scientist C. That is a different thing because they have appointed me for diabetic research. And for last 1.5 years, successfully, I'm continuing the diabetic research. I published 3 papers in diabetic research also, and my cardio research, heart failure research is ongoing alongside. Okay, so in 2019, we have started that funding from Novartis in 2016 January, and the same time I registered my PhD for the same topic from Medical College for the first time in India. For the first time in India, I have registered my PhD 100% from a medical college after being a foundee. No one did from the medical college completely 100%. Now many people are doing. After me, many people are doing. My juniors are doing in gastroenterology. My juniors are doing in cardiology itself. I'm from pharmacy practice people, but I was the first in India to completely shift from pharmacy college to medical college to pursue my PhD, and I did that. In 2019, I was awarded with the PhD in cardiology, super specialized in heart failure. That was a proud moment for all of us, all of me, as a pharmacy, fraternity, and I did that. That I'm proud because I'm interested in research. I did it well. I did it with the enthusiasm, guys. Okay, let's go to the next thing. So I did this. I after I went to American College of Cardiology for 6 months to, it was a 1 year course, but I went there for 8 months to learn global physicians of heart failure. That was awarded in 2018 to me because I was doing the research of heart failure. So I want to become the specialized person in heart failure in India, after that. So I did that. And I am specialized in biostatistics also. So that is my professional and entrepreneur journey. So after my PhD, I was like, guys, what to do? This is another very interesting, journey, guys. Very interesting facts you will, come to know. So the thing, when I completed my PhD, I was supposed to get, assistant professor of research. There are specific vacancies in our university, and there are, I think, now in multiple universities in India. And but that time it was only in Manipal University. They used to hire the people for research in different clinical settings, different clinical departments. So I was supposed to get the assistant professor in cardiology department in KMC for research, especially for research. I mean, not for clinical, for research. But then suddenly, someone, my friends and my one of the mentor, we came together. We thought like, okay, let's do something. Okay, so and I was actually interested in academics also. I used to, I love teaching. I love teaching students along with the research, because research and academics are totally a parallel things, and you can do together. It's very amazing if you pursue your academic and research profession together. So, I tried in pharmacy colleges after that. I mean, I did not join here KMC. I tried in pharmacy colleges, and you guys won't believe, I was rejected from everywhere. I was rejected from everywhere because that was my demand. Like, I need research facilities, and in India, there are no pharmacy colleges who have the good research facilities. What I was looking for. Okay, and there are few, but they did not have the vacancies, frankly. So I was rejected by 7 colleges, pharmacy college in India. I thought like, okay, I'm not going for. I tried for 3-4 months. I did not get. And then we came up, my friends from PharmD and my mentors, we came up with the idea of Scope Medics. Scope Medics was my first startup, what we have started in 2019 October in Hyderabad based. We have started Scope Medics. That is again, the clinical research and pharmacist training. Okay, pharmacist training outsourcing company. We started in 2019. But due to COVID in March 2020, we couldn't do much because outsourced pharmacists were not entertained in the hospitals, and actually hospitals were shut down for any kind of outsourcing services in Hyderabad and outside the Hyderabad. We had our first client, Yasoda hospitals in Hyderabad. So uh, that was the thing that we couldn't do much, and we had to shut it down in March 2020, April 2020. So then again we had a challenge that, okay, what to do. I mean, my registries was going on. My research journey was continued. Okay, my research journey was continued even after the PhD, because I was the part of. I am still the principal investigator of Manipal Heart Failure Registry that is going on for last 7 years, and we are just extending it because we are getting fantastic results. We are getting fantastic results out of it. Okay, so then we again thought like, okay, let's do something, because research is my interest, research is my passion. Again, guys, come to that point: research or interest. It is my interest, it is my passion. Research in cardiology or research. So I thought, like, why don't we do something in the research only? Why don't we go for something in research where we can benefit everyone, benefit all the institutions, benefit all the students, benefit people. So we came up with the idea of CRO. Okay, CRO idea, this contract research organization. Everyone of you know that contract research organizations are there in the market to serve the big industries like Novartis, Eli Lilly, and these, like IQVIA is CRO, and Cactus is CRO, Kinaps is CRO. There are the big CROs in in our industry who aid to the big clinical trial industries or big clinical pharmaceutical industries like Novartis. So they get the clinical trials and continue them as a third party. Okay, so we have started this CleanMed Research Solutions. I mean, in 2019 only we have registered, and we started this. We did not take it further because we were focusing on Scope Medics, and Scope Medics, sat down in 2020 March. So we again, thought like, okay, give 100% to CleanMed RS, CleanMed Research Solutions, and we started CRO completely, where we started medical writing, data management, and regulatory affairs, and other multiple departments. We started that. Okay, and then after that, it was running successfully. In 2020 July, we came up with our educational services and career consultancy. Why? I'll tell you why. Okay, and you will get that fizz here, how to go further from one, how to expand. That is the main point. When I was doing the CRO, we saw I saw that in market everything is there. People are there, who are teaching, online teaching for artificial intelligence, for technology, for education, for law, for everything. But there are no people who are teaching pharmacy students, who are giving something to the pharmacy students online, additional education, or that where people can learn out of the syllabus. That there are no one who was giving the online trainings, online education, and there was no quality. I have gone through a few, but there was no quality at all. People were just using the students to get the money. So I started CleanMed Education Services and Career Consultancy. So try to understand that. I did a market research here. What is the actual need? Okay. I again asked, what is the need? There is no good, education companies or educator in the market. There was no one who can give the economical education. There was no one who can give the quality education. Okay. So CleanMed as CRO is totally different from CleanMed Educational Services. CRO is another wing. It is totally, like different. That is technical work. That is totally research work. Adding the educational services to that was another part. Because I came up after the market research that, okay, there is no one. We can come up with this educational services and career consultancy. where we are today. Actually, I'm teaching you under this educational services only, and I am heading this medical, this CLIMED educational services and career consultancy completely. And CLIMED RS is also, headed by, my all the teams. And I mean, these are my, startups only, but that is headed by others, because that is technical work. All the directors, all the managers are taking care of that. But I love teaching. I was rejected by 7 colleges, but today I am teaching thousands of the students every month. Thousands of the students. You won't believe, guys. Our first course in November 2020, first course was a professional course in cardiology, that was basics of cardiac pharmacology, and it was international record breaker. 11,600 admissions in one course we got. That was 100% free course for everyone. 12-week course, 3 months certificate course we have conducted for 100% free, no money. And we taught 11,600 students in one batch. That was the, a satisfaction for me. Like, okay, I am doing something which is my interest, cardiology research, and I am teaching my students. All my interests were going together, and still all my interests are going together. Okay, all my interests are going together, still all my interests and passions are going together. So that time and today also, in our courses and our card, recently I have to introduce one more cardiology course, and there are multiple courses going on. Almost 50 plus courses are going on. Everywhere we get 500, 700, 800, thousands of the people to attend those seminars, webinars, college, or courses. So I'm teaching thousands of the students. Okay, that is the satisfaction. So that is going on. And then this WYHF, World Youth Heart Federation, is another one of our MBBS friend. They came up with this idea, like, okay, we want to start something, like World Heart Federation is a big organization all over the world. And this is the NPO, non-profit organization, WYHF, where we are just serving people, where we are just giving the free education in cardiology, and related to heart, to all the people. In COVID, we have gathered around 56 lakh rupees, and we have distributed ECG machines, we have distributed PPE kits, we have completed lot, or we have helped around 3 lakh people in COVID, guys. In COVID first wave and second wave, we have helped around 3 lakh people with 56 lakh rupees, under WIHF. So that is another entrepreneurship, journey for me. And then, out of the box. I mean, this is really hard. This is related to heart and cardiology, but out of the box because I wanted to do something. And then, this, you will be surprised, this Indika AI. This is Indica Artificial Intelligence company based in Mumbai. So it's not mine 100%, but in the collaboration, I mean, in the partnership with some of my friends. So I am working as a president for medical artificial intelligence. Why I entered to artificial intelligence? Because I want to learn it. I wanted to learn it. That's why I'm telling you guys, whatever comes your way, go to the market research, do that. If you are not interested, sometimes if you feel like, okay, it is okay to pursue as a career, first of all, go for interest. My interest was continued, my interest is still continuing. But out of the box, what else I can do? I went for medical AI, because AI is the promising, AI has the promising future. Okay, so we entered to Indica AI, and we have started, multiple Indica AI is doing in agriculture, in medical, in, thousands of the, I'm telling you, thousands of the, projects are going on in marine engineering, in agriculture, in, aeronautics, in, other technical sites, and in medical itself. I'll tell you one project. Recently, we got one project from Philips. They are looking for, AI based MRI machines. So, we are helping them in developing AI based machines. I mean, AI based MRI machines, where, they will give the provisional results also, provisional, diagnosis also immediate after MRI. It will not be like that doctor has to analyze. Doctor has to still analyze, but they will give the provisional diagnosis based on the AI, based on the MRI reports. So that is my entrepreneur journey. Let's go to the further things. So the baby steps in the research, as I told you, this this workshop, this webinar is also on the research and entrepreneurship in pharmacy. So my baby steps in the research, my case report, first case report was published in 2014 in British Medical Journal, and then PharmD internship and cardiology, I told you, and the research grant of 1.2 crore from Novartis. And then, yes, that's very interesting journey, guys. So I was the first person who started, doing PhD from the cardiology from a medical college, and I was starting this Manipal Heart Failure Registry as the principal investigator because that was our idea. And I got a very, very, very good mentors here, and the cardiologist, the then HOD cardiology here at KMC Manipal was very supportive. He told Ajit, see, you take over, you only handle everything, you be the PI. Okay, I'm in joint PI. He is again the PI with me, and I was also the joint PI with him. So sort of like, okay, Ajit, you only hold it. And along with that, because it was industrial funded from Novartis, and all the funds used to come from Australia, so our DCGI, Drug Control Journal of India, they have stopped me in between, like, okay, a pharmacy guy cannot be PI in any kind of clinical trials. Okay, why? Because it was not happened yet in India. Okay, I was the first who was applying for PI position from the medical college, being a PharmD. Okay, I mean the other MPharm units, other MPharm people used to, conduct the clinical trials, but only as co-I or sub investigator or research associate, anything, but not principal investigator as a clinical trial, not 100% clinical trials as a principal investigator. Nowadays, I appreciate JSS because JSS has shifted their clinical trial unit to pharmacy practice. They are run, that entire section is run by the pharmacy practice. Still, it's not in Manipal, but JSS is running that. The entire clinical research setting is run by the pharmacy practice, pharmacy people. So that time, and this is it. This was happening first time in India. So I fought with DCGI for 6 months to get that position. I showed up many of the evidences from from the European countries, from the Western, from the America, from Australia. There only PharmDs and pharmacy people are heading the clinical trials, and they have medical people in their research. Medical people must be there in the team to to handle any kind of emergencies, to handle diagnostic things, and to handle the final diagnosis, and to see the sign and symptoms. But it is not necessary that only medical person can be a PI, principal investigator. So I was the first one who was fighting. I fought with DCJ, and finally they surrendered and they told, okay, go ahead with the PI. So after that, guys, because I was interested in research, I started that research from the baby steps. Now anyone can go from pharmacy and tell, okay, I want to become PI, and they will be the PI. There are multiple people who are working as a PI and who has started clinical trials, randomized clinical trials in India and from outside India, and who are working as PI. Because I opened the way, we opened the way, we fought. If I also thought like, okay, yeah, it's okay, if I being a sub I or co I, why I should be, because I had that support from my clinician part, from my HOD, from my mentor that time. So I also got that encouragement to go for this. I fought with DCJ and we got it. Okay, guys. And then I have participated in these multinational clinical trials. Manipal Heart Failure Registry is our own brainchild. We have started in 2016. 2015 November, we got the approval, and since then it is continued. Report HF is a clinical trial from Novartis. Paradise, Parallax are the phase 3 clinical trials what I have headed at my center. As co-I, as PI, as at my center, I have headed these multicentric international clinical trials from Novartis. At my site, I was handling these things, and here they have researched multiple drugs like sacubitril valsartan for heart failure. You must have heard of sacubitril valsartan combination for heart failure. That is very promising drug. It's costly but promising drug for heart failure. We did that research in our center at Manipal under my this, along with the clinical HOD of the cardiology HOD, then my sir, my mentor. So if you start, like, see, look at this, look at this from the one case report to heading the international clinical trials. This is a journey. This is journey of struggles. This is a journey of enthusiasm. This is a journey of your dedication. If you are dedicated, you can do that. And research journey starts from the base baby steps. You cannot directly jump to anything. You have to start that learning. So you have to start that journey from your basic studies. Okay. And then 2015, my research positions. 2015 to 2019, I have worked as research associate in the department of cardiology at KMC Manipal. The position, by the way, I was heading this team, but university has to give some position and you have to work on the position. So I was working as research associate. Then I left, and 2021, guys, if you are in research and if you are pro, I'll tell you this incident again. I left KMC Manipal because I started Climat Research Solutions and Scope Medics in 2020, and I was working with my startups. So I got the call from ICMR. Usually we go and we beg ICMR to give positions. ICMR people knew me there, so they called me directly. Like, okay, we are continuing one diabetic research registry for last 10 years. They have started that in 2008, sorry, 2008, phase 1, phase 2. They have completed till 2019, and they were expanding phase 3 of that diabetic registry, young diabetic registry under 25 years of age. People under 25 years of age who are getting diabetes are included in that. That is very restricted but very interesting and very important thing. They are, because they are mapping the diabetic young patients who are getting diabetic less than 25 years. And you won't believe, guys, there are people who are just, there are the patients who are just 4 months old to 25 years old in our registry. They are suffering with the diabetes. So ICMR called me. They told, like, you come to Delhi and now you head the phase 3 because you have that interest and you have that experience of conducting India's largest heart failure registry. So they told, okay, you come and join our phase 3 trial as research scientist. See, there are multiple people that is headed. The research is already headed by multiple people there are heads, there are principal investigators, they are from ICMR and all, but they told, you come and join us as a scientist, see, at ICMR Delhi. I told, I'm not going to come to Delhi again. I'm not going back to Delhi. I'm from there, by the way. But I told, no, I'm not going there. So they told, okay. Then they gave me another proposal, like, okay, if you are, I am in Manipal. I left KMC, I left working with Manipal, but I was still in Manipal. So they told, if you're in Manipal, then what we can do is, there are 10 centers in India. There are 242 sites in India, 242 hospitals involved, but to hold those 242 hospitals, they made 10 coordinating centers. They told, like, okay, you go, and Manipal is one of the coordinating center. You take care of the Manipal coordinating center. They made me scientist C and sent me to Manipal coordinating center. Right now, I'm handling 12 hospitals, including Yenopoya, Mangalore, including Father Muller, including Nitte, including KMC, Mangalore, multiple hospitals. They are under my surveillance because I'm in just for young diabetic registry. I am the monitor. I'm the head for all these institutions for diabetic registry, young diabetic registry YDR phase 3 right now. They proposed me, they called me, they invited me to become, and they even proposed a good salary also. So that is the power of your enthusiasm. That is the power of your dedication. That is the power of research, guys. They called me, and they did not have that condition also that I cannot continue my company. They told, this work is a little time, needs a little time. Okay, so along with that, you can even continue with your companies. So that was the best thing for me. What else I need, right? So that is the thing what you can do with the research, what you can do with your dedication and passion and your interest. Okay, until date, guys, I have published 50 plus research papers, 3 book chapters, editor in chief of 2 journals, editor in chief and editorial board members of 12 journals, and I have reviewed more than 50 articles till date in Oxford, BMJ, in Springer, and multiple big organizations, big publication houses. Okay, 10 plus countries, as I told you, I have been there. I have presented my work for guest talks. I have been, and I won till date 5 Young Investigator Award selected by European Society of Cardiology. European Society of Cardiology is one of the biggest society in the world, where they generate the guidelines, and in India also we follow American College of Cardiology guidelines and ESC guidelines. Everywhere in the world they follow ESC guidelines, and ESC only funds me every time to present my work in their conferences. Recently, as I told you, I visited Madrid, Spain in May, June. So if you are interested in research, start with the baby steps, do it, grow it, and go to the best what you can get. Okay. Then, as in my introduction, they told I got Young Investigator Award, Young Achievers Award in 2019, Young Scientist Award from in 2020 from ISC, ISC, Indian Institute of Science. Right. So now the thing is, I'll come to that part, the entrepreneurship part, how we can all build the career on our interest. That was my journey, but how we all can build that. First of all, definitely you need your interest. As I will correlate with my journey again, my interest was research and cardiology. I got motivated because my first paper was published in 2014 in British Medical Journal, and after that it was unstoppable. My journey in research was unstoppable. So that was the motivation for me, and not only the motivation. Motivation was not only by the paper publication, by the result of my research. It was from my colleagues, from my mentors, from my friends. Okay, at the end, this climate research solution is a part of my friends. My friends from FarmD, and we all came up together and established climate research solutions with our mentors. So that is kind of motivation what you get from your friends, from your it's not like that you always have the friends as a competitor. If you have really good friends, if they leave you, if they are a part away from you, my friends who are who have joined me in climate research solutions as advisors, as motivators, as faculties, as they all are in USA, Canada, Australia. They all are outside India, only few are there in India, and we all came up and came up with the climate research solutions. And guys, climate research solutions is almost 1 billion rupees worth company to today. So it's a big deal. If you are really interested, you can build your career on your interest with the motivations and explorations. As I told you, explore you have to do. Explore definitely you have to do. Right, in research, as I told you, if you are get the best in your interest, get the best out of your interest, explore the things, explore the things where you can go with your interest, like I did in clinical research. In clinical research, I okay, clinical research, there are multiple things. I could have joined any job, I could have joined any clinical research center, I could have joined any hospital, I could have joined any ICMR. In starting only, I could have joined hospital as a clinical research coordinator or something. But I explored the things and I chose the best, and the best was I can start my own clinical research solutions company. Right. So that is how you can get that exploration. After exploration, you should come up with that. Okay, and then of course idea, go for the risk assessment. I'll tell you what is risk assessment here, why you should always do the risk assessment. Risk assessment is nothing big. Okay, you do not have to go through the parameters of management to assess the risk and everything. Just look at where this will take you, where this will take your career, where this will take your life. If you feel like, okay, there is nothing worth in the future, don't go for it. If you really feel that with your dedication, with your hard work, with your motivational things, if you can go up and if you can take it up, please go for it. Okay. take that risk. Take that risk. Assess the risk, but you should also have the courage to take that risk. Okay, once you are ready to take the risk, go and do the market research. With what you can exactly start, what is the need? You understood your idea, you got your idea, you assess the risk. Now what exactly market needs, start with that and implement. Once you're done with the market research, as I'm telling you, do the market research. People need the education, okay, and people need the AI. So that was my market research for me, based on my interest, based on my exploration. For you might be different, for you something else, for you it could be something else. So go for that and then implement those ideas with the support of your friends, with the support of your people, and with the guidance of your mentors, your parents, your brothers, friends, everyone. It is very, very important, guys. So that's how you can build your career on your own interest. So I always tell my all the students, all my friends, all my colleagues, please choose your interest, guys. Okay, and see, one more thing I want to talk to you guys here. When we are kids, okay, when we are kids, we have seen multiple people, I mean that the rich layer, I'll not say that, or not exactly the rich layer, the well educated people, well educated layer of our country. So they decide their kids future from that only, or their kids also, they find their interest from the basic from the basic education only. Like when they are in fifth class, sixth class, or until they're coming to that high school level, they find their interest. Okay, I want to become pilot, I want to become doctor, I want to become engineer, I want to become journalist, whatever is there, they find their interest. But my theory is a little different. It is not necessary that you born with your you can you have to start getting your interest from starting only. If you are not having any kind of interest till 12th, till your degree, once you start your degree, once you are in the B farm, or farm D, or in M farm, or wherever, there is a lot of time to find that interest. One is very keen interest, one is interest, and interest which is career oriented. Okay, so if you are not, if you don't have your interest found till that level, then now there is nothing late to find your interest. Suppose I'm a PharmD student, I'm in third year, fourth year, fifth year. Till now I got all the departments. Till now I read cardiology, gastroenterology, I read respiratology, I read surgery, I read psychology. I should get where I fantasize the most. What subject fantasizes me the most, right? What kind of patients I get the interest, what kind of patients I look more into. Based on that you can find your interest. Based on that, like, okay, if I am into studies, if I am into hospitals, I want to become the clinical pharmacist, I want to go for the job, I want to go to the industry, or whatever. Find your interest now. It's not necessary that you have found your interest before only. You can find your interest anytime at your life, but do it. Don't go without your interest. If you are interested in something, then give your 100%. जी जान लगा दो, right? So give your 100% once you are interested in something, right? As I did for cardiology and research. Sure, you can do that. I really believe that you can go for your interest, and you can really have a good career in future. But for that you need to take care of something. Okay, you need to maintain the pace. Okay, you just need just not just nothing to start. Like, okay, you have started with the passion, enthusiasm, and after that you feel like, okay, I'm not interested now. Okay, like you found your interest in entrepreneurship, you started something with very good pace, but now you're telling, oh no, my interest is something else, I want to become a writer. Now I want to become the motivational speaker. I can't continue this. No, guys, no. You need to maintain the pace. After sometimes you have to sacrifice a lot of things. You need to motivate yourself now. Once you are done with the starting, once you are done with your interest, anything, you have to self motivate you to do that continuously. Okay, you have to, exactly as I'm telling, constant interest is needed. You cannot say after 2 years of after 2 years of climate research solutions, I cannot say like I'm not interested anymore. Okay, because it is something what I started with my 100%, with my interest. If I'm getting something else in my interest, like AI, artificial intelligence, I can go for that. I can give some time to that, but I have to give my time to this also. You can expand a lot of things. You can get a good team. You can hand over the you can hand over your work, whatever you are not interested, to the good team, but don't leave that in between. Your constant interest is needed. Okay, anything could be joining your interest, anything could be joining your passion, your career, but your first interest must be your first interest, and you should self motivate to that. Okay, and constant interest is needed. Constant support and guidance is also needed from your friends. Don't leave your friends, don't leave your guide, your people who are guiding you, who are helping you in growing your career, helping you in growing your entrepreneurship, helping you growing your research, because these all things are teamwork. Research is a teamwork. Okay, research is a multidisciplinary teamwork. People, many people are needed to conduct the research. Data collection, people, data entry operators, coordinators. There are research associates, research assistants, PI, co-PIs. Multiple people need it. Analysis, for analysis you need a statistician. Multiple people. This is a common interest of many people. Okay, so you need that good team, good support from the team, and good guidance. You should always maintain that. You should always maintain your support, your guidance, and that will be maintained. If you are humble, everyone will be humble with you. If you are good with everyone, everyone will be enthusiastic, everyone will be good to you. If you are showing the dedication to your work, everyone will show dedication to your work. That's needed. That's very much needed. And focus, of course, and then dedication, as I told you. And then very important thing, delimitation in your working hours. See, if you are in the research, I'm telling you, especially for these two things, as you are in the research, and today's topic is also research and entrepreneurship. If you are in these two fields, research or entrepreneurship, or research and entrepreneurship, you have to delimit your working hours. You do not have to say, okay, today I have worked for 12 hours, enough. I have worked for 8 hours, enough. No, it needs your dedication. Whatever, however you are working, it will grow you. How much ever you are working, it will grow you more. Okay. So sometimes you have to restrict your sleep also. Sometimes you have to sacrifice your sleep. Sometimes you have to sacrifice your, movies. Sometimes you have to sacrifice your family time. Many things are there. You have to delimit your working hours. You cannot restrict your working hours in research or entrepreneurship for 10 hours or 5 hours or 6 hours. Not at all. Otherwise, you will be at the same pace. You cannot go up. You cannot grow. Okay. And if you are working towards the entrepreneurship research, you need that constant growth. You cannot take your chart, you cannot take your graph as a constant rate. You always must grow. So for that, you have to sacrifice a lot of things. You have to delimit your working hours. That is my personal experience, guys. Sometimes you won't believe I sleep 3 a.m., 4 a.m., 5 a.m. Okay, and but maintaining your sleep, maintaining your health is also important, but it is not necessary. I'll tell you one more funda of me, which may give you that kind of side. It's not necessary when you are sleeping. Okay, people tell that is important, that if you are if you are waking up in the early morning, and if you are going for a walk, if you're going for a jog. But if you are in research and entrepreneurship at this age, I feel sleeping is very important, but not the time. It's not necessary when you are sleeping. If you're sleeping in the day for 2 hours, 3 hours, 4 hours, and in the night for 4 hours, it's okay. You should complete that 6 to 7 hours. If you are sleeping in the morning, you are waking up at 9 or 10, it's okay, because you were working last night. It's okay. It is justified to wake up at 10 o'clock because you were working till 4 a.m. Okay. It's not necessary when you are waking up, when you are, sleeping. I mean, in this dedication and in this, I'm talking about this, not generally people, not generally, but if you are in the entrepreneurship or if you are in the research, you may have to delimit your working hours. It's not necessary that if you're working till 5, you have to, wake up again at 6. Not necessary. You can sleep up to 10. That's okay. That's fine. That's totally justifiable. Okay, but maintain your health and everything, maintain the pace of the work also, because I have my clients from USA, I have my clients from Canada, I have my clients from UK. If they are not agreeing for the day meetings, I have to wake up for them till 3 a.m. I have to work with them. I have to work with my Canada team till in the morning my morning 6 a.m. morning 5 a.m. So it is to maintain it is the maintenance. It is you have to maintain that, right? You have to maintain with your collaborators. You have to maintain with everyone, and then get the sleep, get your time whenever you get it exactly. Okay, it's not needed that it is not needed that you have to wake up in the morning 6 only, right? So that's important. Okay, and satisfaction is very important. You should celebrate small things. You should not be like, okay, you should be hungry for the growth. You should be hungry for your work, growing exponentially, but you should be satisfied at every point. Okay, you should be satisfied at every point. Okay, I did this, my team did this, we are very happy. We launched one more course, we launched one more, we have started one more webinar, one more workshop, we have did, we got one more project. Celebrate everything, satisfy yourself with everything. Don't be in that like you are not satisfied at all with your work. Be satisfied, but with that hunger to grow, hunger to get more. Okay, that's important, guys. So before I thank everyone, I would like to say, guys, I invite all of you to our two recently launched courses. These are six months courses, 6 months professional certificate course in fundamentals of clinical research. This is a 6 month skill development program. Very fascinating program my team has designed, because here they are providing 4 months completely theory training, then 1 month self grooming for your for the industry, and then 1 month industrial training, dedicated industrial training with separate certificate. And then you must know that comprehensive clinical sas, this is like combination of all things. Till date we have completed 4 batches of base and advanced SaaS, but this time we have launched along with the clinical SaaS. And these 2 courses we have recently launched. So if you're interested, you can contact me later, or you can contact my team on support@cleamer.in, and this is my phone number. So guys, I would like to thank you for listening patiently. And again, I would like to thank Dr. Ambu and Ms. Tanuja for coordinating well and for inviting me to this, and Pan Pharmacon Student Club, Department of Pharmacology, Faculty of Pharmacy from IIA University of Applied Sciences. So, and all the faculties, all the students, thank you very much for joining. And now, floor could be, open for questions. I believe, yes. Thank you, guys.
Thank you so much, Ajit sir. Dear participants, now the session is open for question and answer, and your microphone has been enabled. So if you have any queries, do put it up. Uh, our speaker will be glad to answer this.
Dr. Ajit, good afternoon, Dr. Ajit.
Good afternoon.
Uh, I would like to introduce myself. I'm Dr. Shabi, working as I'm a professor come head of the department of Icon Pharmacy College.
Hello, sir.
Yeah. Um, Much has been elaborated in this webinar by you. It's very interesting, especially for the how can we all build our career, especially for a lot of students are here. It's very impressed, especially for interest, motivation, exploration, market search, risk assessment, implementation, support. And it came out very clear that in the situation, in the research is not an easy one. But I feel that webinar has been motivation and this platform to start engaging the research. I would like to appreciate Dr. Ajit. It's very good actually. And I would like to take this opportunity to thank you very much for inviting me to attending this webinar in this open platform. It was excellent organized by Dr. Anbu and team. It's a great honor, particularly as I'm more than most people here. Dr. Anbu is here and team is here. I just want to know about, as a pharmacologist, I want to know what are the openings for ICMR, especially for the students who are, upgrading their program, especially for the postgraduate graduate program. Is there any ICMR projects, combined with the PG programs?
Sir, I'll tell you in two ways. If the people after M.Pharm pharmacology or after PharmD or after pharmacy practice or any kind of things, if they're looking for the jobs, there are multiple jobs. Okay, for the jobs I'm telling, there are. I'll come to the grants also. I'll come to the other positions also. So they can apply as a research coordinator, research assistant, research associate based on their experiences, because as I told you, the experience does not matter that what you have done after the degree. It is like what kind of experience you have. If you have published 4 or 5 papers, you can apply for research associate also. If you are M.Pharm, you can apply for research associate also. If you are PharmD, you can apply for research associate also. There are multiple projects. You can go to the AIMS website. AIMS is the major website where they usually give the ICMR projects. AIMS website, AIMS Delhi website, and you can go to the ICMR website also. In the job search, you can search for research assistant, research associates, and they entertain all the M.Pharm people. They have their specifications like MD or M.Pharm. Okay, they don't mention PharmDs right now because they are not aware much, but they rightly mention M.Pharm, MSc pharmacology or M.Pharm pharmacology, or they clearly mention that with MDs. So the same, and the salaries are really good for research associates, research assistants. They start with like for research assistants, coordinators, it starts with 30,000, and for research associates it's like 50, 60,000, 70,000. And even sometimes they give 1 lakh plus for the research associate 2 or research associate 3s. So there are multiple vacancy. You just have to go. The students must explore the ICMR website and AIMS website every 10 days, because there are thousands of the projects going on all over India. And all the projects, whoever is searching for the collaborators, whoever is searching for coordinators, whoever is searching for research assistants for ICMR jobs, for ICMR projects, they give their job through the ICMR portal, so people can get that. And the another thing, if they are looking for kind of grants or kind of pursuing their things, so there are GRF and SRF facilities even after M.Pharm, after PharmD also. Now they have started. If you are looking for PhD or something, if you really have a good research topic in your mind, discuss with your guide. If your guide wants to pursue something under the SRF or GRF schemes, they can go for. And another along with that, there are every month there are 4 to 5 ad hoc projects. Okay, ad hoc projects can be applied by anyone. By anyone means by the students, by the faculties. You can apply for that. And not only ICMR, I must add DST-SERB and CSIR also. CSIR is company and scientific research of company Committee for Scientific and Initial Research of India. So you can apply for CSRI also. You can look for that also. There are multiple positions, multiple research grants, multiple ad hoc grants, multiple travel grants are available. It is like just you have to explore. Every 10 days, go and give 1 hour to search these websites. There are multiple opportunities, people. There are multiple opportunities.
Thank you, Dr. Ajit. And one more question.
Yes, sir, please.
Maybe it's looks like a personal question, but maybe it's motivation for the students again. You
Please
said
go ahead, sir.
the year of Form D, your project was MRSA. Then what influence to shift over to the cardiology from MRI?
No, sir. MRSA was the project which was given by my, the research head that time, the research faculty. But I was still interested in cardiology. So my passion was to learn cardiology. That is again a story. I had, some kind of cardiac issues when, I had a congenital anomaly when I was child. That was corrected that time. So that, stretches me to the cardiology.
Okay. Okay, thank you, Dr. Ajit. And
Thank you,
I
sir.
could see some of the mail came from the Ramaya University. The tentative topic in future. Now, I'm so much interested to attend the career opportunity for pharmacy graduates and importance of research in pharmacy. understand the heart attack related things. No, these are the
Yes, I sent around 4 topics.
But no, I would like to, thank Dr. Anbu to choosing this topic because it is great topic in this scenario, I think. So thank you, Dr. Ajit, one
Thank
again.
you, sir. Thank you very much. Thank you. Thank you.
So before we end up the session, so I'd like to point out something from your talk.
Yes, sir.
Actually, it was amazing to learn that the employers are giving opportunities for more than 60% of the students, that is freshers, who are having a good research background. And also from your talk, you have emphasized on the importance of research and the publications during learning period itself. And also it is really good to know that about 11,600 students got admitted in the certificate course. That is also a free course. So really I appreciate and heads up for your wonderful educational service, sir.
Thank
And
you, sir.
apart from that, you have explained the career journey and entrepreneurship opportunities with your own struggling experiences. And really, it was very interesting, sir. And also, I hope that examples you have given will really encourage our students too. And before concluding this session, on behalf of Department of Pharmacology, Faculty of Pharmacy, and all the participants, and I wish to, I wish you all the best for your career journey, and also would like to hear more and more success stories in future too, sir. So I am very much thankful to you and your team for giving this kind of presentation. So thank you very much. Now I request Damodar to continue further.
Thank you, sir.
Dear participants, if you have any queries still, you can ask. We will be having question and answer open for about a minute.
Yeah,
Then
yes, sure, sir.
Final vote of thanks.
Good afternoon, sir.
Good afternoon.
This is Dr. Saraswati from Ramaya.
Yes, Dr. Saraswati.
I just want to know about the registry, sir. The heart failure registry. So we are planning for application of AI in predicting the readmission and adverse reactions. So we were trying to explore other registries from US and Europe. Do we have a proper registry for India in place, sir?
Yes, definitely. See, heart failure registries are there. Now, our registry is there, Manipal Heart Failure Registry. Another registry is Trivandrum Heart Failure Registry. Okay. I mean, unfortunately, we don't have anything from North India or from the northern part of India. We have one from, Manipal, and we have one from Trivandrum, Sri Chitra. So they also are doing a really great job. They have, included thousands of the patients in that. So you will get the basic information what you exactly are looking for, the AI for readmissions and the outcomes. Okay, that you can get because we have analyzed the outcomes, we have analyzed the health related quality of life, we have analyzed the financial burden of the economic burden on the heart failure patients. We have included all the treatment patterns, all the whatever is needed, because registry includes everything. So we have analyzed the long term outcomes, also long term readmissions, long term mortality also. So it will help you designing the artificial intelligence algorithms. For that you can cite our registry, you can cite Trivandrum Heart Failure Registry for that. And for that, if you are looking for, definitely I would suggest you to go for the international registries like Report HF. Okay, and one is European Heart Failure Registry. I would suggest you to go for that and read that. And there are multiple papers, different papers you can cite, and you can definitely design that. We were also thinking of that a long back, but due to the feasibility we couldn't do that. But it's amazing topic, madam, amazing topic. You can go for the AI to predict the readmissions and the mortality.
Do we have a chance of getting a collaboration either with you or the Trivandrum's HF unit, sir?
Ma'am, I think the Trivandrum people have shut down their registry last year because they have done their 10 years. because it was going on, and right now that is, I think, not going on. I'm not very sure. Dr. Hari Krishnan is the PI there at Sri Chitra Tenule Hospital, Trivandrum, and in our hospital, we are not entertaining any kind of collaborations for registry, because that is a team thing, and our institution is, because this has become a really big, so they are not entertaining exactly the collaborations for this registry, because the other people also have tried, and we also have tried ourselves, because we thought to try with the we thought to go for it internationally, but right now the university said like it's their own right. Sometimes we cannot go beyond those administrative things.
Okay, will you
But I
be
would
able
suggest
to?
I would suggest you to go for your own, I will say, and
Yeah,
please apply for ICMR, or please apply for the industries, because they are very much interested in that.
that's what. Can you? Will you be informally guiding us?
Sure,
Uh,
sure, sure, madam.
okay.
Anytime. You can contact me for that. I'll be helping you throughout. No problem at all.
Okay, sir. Thank you, sir.
Yeah. Thank you.
Good afternoon, sir.
Yes, madam, please.
So this might sound silly, but like, how do you actually know what really interests you, like about the subject when you have confusion over like a variety of subjects?
The thing I told you, one thing, whatever fantasizes you more in your subjects, in your interest, in your journey, like maybe entrepreneurship, maybe people want to, after I have seen a lot of people. This is a maybe out of the box example, but people after IITs and IIMs, they are becoming motivational speaker. They are going to film industry. They are going to something else. So it is not like they have their interest chosen when they were kids. They found that when they are studying, they're like, okay, now I'm not made for this. I'm not for this. I have to do something else. So that is again in your when you are in the education, there are multiple subjects, there are multiple ways to go ahead. Like you are a pharmacy students or M.Pharm students, or pharmacy students, you are reading pharmacology, you are reading pharmacotherapy, you are reading pharmaceutics, you are going to know about industry, you are going to know about clinical pharmacists, you are going to know about hospital, you are going to know about entrepreneurship. So whatever fantasizes you the most, whatever gives you the more satisfaction, go for that. That is your interest actually. Like I love seeing, like, okay, patients are coming with heart attack, patients are getting heart attack, how we can stop the heart attack. That fantasizes me more. That tell me more how to control the heart failure, how people are suffering with heart failure. Some people are that actually a trigger point for you. Like, okay, some people are more interested in oncology, some people are more interested in orthopedics, some people are more interested in pediatrics. So that is, you have to choose, you have to look at yourself, you have to clear out your confusion, you have to look at yourself, and you have to see what you are doing more. Okay, what kind of things you are doing more. You are doing oncology more, you are doing cardiology more, you are doing whatever, I mean, whatever gives you more satisfaction, whatever you are doing more. Sometimes it is kind of your interest, and try to build for some time, like for a month, for or 2 months or 3 months. Then you will understand, oh, I was just doing, maybe at the time of friction I was doing that, but it is not my interest. So there is one more thing I want to tell you. It is not necessary that you find your interest very very easily. you know you may have to give some time, you may have to give some tries, and but definitely you will get your interest. So that's easy to find out actually. I mean, easy to find out means you can give multiple tries, but it's easy to find out. You will get that click, okay, this is what I want to do, this is what gives me more satisfaction, this is what where I can go further. These questions are very important. Satisfaction, where I can go further, what is more feasible to me, that those things are very very important to when you're finding your interest.
Thank you so much, sir.
Thank you.
So it's really a pleasure to present a vote of thanks at Dr. Ajit. So really it was a nice presentation and on the topic at research and entrepreneurship in pharmacy. Definitely in our PharmD students mainly will get benefited from this presentation. So you have emphasized on many things from your own experience right from the zero level in your career, and how you have shifted from your pharmacy profession to entrepreneurship. So really, I am very much thankful. And before that, I would like to thank our management and my dean for continuous encouragement. And also, I am very much thankful to Mr. Damodar, who is coordinating this event. And also all my department colleagues and my students and all the participants. So for having been here for past 1.5 hours, more than 1.5 hours. Really, it was an amazing discussion, sir. Thank you very much for your time.
Thank
And
you.
in future also, we would like to have your session, sir. Please.
Definitely, sir.
So, and in your tight schedule, in a very short notice, you have accepted our request. So, really, we are grateful to you, sir.
Thank you, sir.
Thank you very much, and
And
thank you one and all. And with
yes, one more
happy
thing I
Ganesh,
want to add.
sir.
One more thing I want to add. Everyone said that our company has under the MOUs with almost 150 pharmacy institutions in India, including top notch like DY Patil, Bharati Vidyapeeth, and in Karnataka also Sarda Vilas, JSS, and multiple colleges are there under our MOU, where we are training their faculties, their students. So if you really feel to give us a chance, so that definitely you're welcome. Thank you very much.
Definitely, sir. We will keep in touch. So definitely, we will have it even at least an unofficial collaboration in this aspect, sir.
Definitely, yes. Thank you.
Okay, thank you
Thank you.
very much. Thank you one and all.